Hi friends, I'm here to speak to you about something that may not at the first instance appear to be very relevant during this calamity, that is the COVID-19 outbreak that has hit the entire world. I'm here to talk to you about deep brain stimulation and how COVID affects it. The way we can think about this problem is that there could be two groups of patients. One who have had deep brain stimulation surgery done in the past, and those who are awaiting their surgery. As some of you may know already, deep brain stimulation is surgery towards helping patients who are suffering from movement disorders and other related conditions. It involves placing electrodes deep in the brain and putting in a pacemaker somewhere in the chest wall. And we can think of this surgery as probably like pacemakers for the brain. During this coronavirus outbreak, most elective surgeries have been postponed in most hospitals around the world. The patients who are suffering the most are the ones with the chronic conditions like Parkinson's disease, who may be awaiting deep brain stimulation surgery, whose date might have come sometime in April or May, and now it is being at the risk of being postponed indefinitely. So, what do these patients do? First, do not panic. Consult your movement disorder specialist, your neurologist, who might, through teleconferencing or through telemedicine, adjust your medicines so that you are able to cope up with the intervening months of disease. The other issues that may come up are the patients who've already had DBS, and if their battery is at the risk of being run out, what do they do? Sudden stoppage of DBS can lead to a rebound worsening of symptoms, both in Parkinson's patients and sometimes in patients who've had surgery for a condition called dystonia. If the battery suddenly runs out, they get into a state called status dystonicus, which is an emergency situation. So, in these situations, your doctor could agree that this is indeed an emergency situation and can, if both of you agree, can have the battery replaced as soon as is practically feasible. Patients who've had DBS may have other problems, some of which could be discomfort or problems at the operated site, wound related issues if they've had the operation recently. And some of these may definitely require a visit to the doctor. So, when you're going to the hospital, please make sure that you take all adequate precautions and make a decision to go to the hospital only if you think that it is absolutely essential. If, depending on your circumstances, if you live in a place where you have access to the doctor over the phone, over telemedicine and things like that, try to utilize all those and do make a personal visit only if absolutely indicated or if your doctor really wants you to come there. The other routine visits that the Parkinson's or dystonic patients who've had DBS go for is what is called a programming visit. It may happen every month initially and every 3 months or every year later on. And these are visits to basically tweak the battery and adjust the Parkinson's disease severity to the battery settings. That is basically like tuning a radio. So these tuning visits can definitely be postponed, and during that period, the medicine dosing has to be altered as per the advice of your physician, that is your movement disorders neurologist. So I hope this video has helped clarify a few issues, and if there are any questions, doubts, comments that you will have, please do post it on the comment section below. Thank you.